Good morning, good afternoon, good evening, everyone. Welcome on behalf of the Boost team. I think we can go ahead and get started. I want to pass it along, since I know we're already a few minutes past the start of the session, to Team Immunization Champions, who are our first group from our advanced community activation training to present. So over to you all.
Thank you very much. This is Immunization Champions. My name is Eunice Musembi. We welcome you to this meeting today. We are going to learn together. We are going to share knowledge together. We are requesting you in our chats, if you can just write your name and tell us where you are listening us from. If you have any question, feel free to share it in the chat. One of us is going to respond to it. Thank you very much. So we are going to get off started, and I'm going to project our presentation as a team. So our team, we have a slogan that leaving no child behind and empowering opinion leaders as immunization change makers. We call ourselves Immunization Champions. This is the agenda for today. This is what we're going to focus on. We're going to introduce the capstone members. We will do an outline or the objectives of the webinar. We are going to look at the facts about immunizations, critically looking at the gaps globally. We will look at vaccination and immunization, then we'll bring in the role of opinion leaders, which is our core mandate for today. We have a narrative, a public narrative, which is a video that is actually documenting the whole story as to why. It's a success story that is telling us why really opinion leaders matters when it comes to immunization. Then we'll come up with a way forward. We'll have a question and answer session, and then we are going to have a close-up and a vote of thanks session. This is the team that is behind Immunization Champions. On my right is Eunice Musembi, who is speaking. Some of my team members are in hard to reach areas, so the network is not so good, so you may not be able to see them physically in this video, but these are the photos. When you hear Dr. Mahmoud Faiza is from Bangladesh, is one of our team members. We have Ms. Umu from Liberia. We have Mr. Fred from Malawi. And we have Ms. Lotalis from Tanzania. This is the great team that is behind this webinar today. So we are going to start by asking ourselves, immunization, whose responsibility? Whose responsibility is it to ensure that every child gets immunized? We are pausing at this point for just 1 minute. If you can type in the chat box, just tell us, whose responsibility do you think it is in terms of immunization? 1 minute, let's type and see. Thank you very much, Abdi. All of us, it's our responsibility. Our community is our responsibility. The responsibility of the mother, my responsibility is everyone, community, parents, and the government, everyone, is the whole community. Yes, thank you very much. And we all agree that it's the community, it's everyone's responsibility to ensure that our children and everyone who needs to be immunized is fully immunized. So thank you so much for your response. So at this time, we all agree that immunization is all our responsibility. And that's why we are bringing on board opinion leaders who are at the community level to ensure that they all play a key role in terms of leading the process, ensuring that mothers, their children, every key player in the community, the guardians, the parents, everybody is taking lead in ensuring that all our children are actually immunized by getting the right information, addressing any misconceptions, and much more. So thank you very much for your response. So we move to the next slide. And this we have already covered. So at this level, I want to welcome Dr. Faiza, who is going to take us through facts about immunization gaps globally. Welcome on board, Dr. Faiza.
Yes, thank you, Ines. And as we know, the global immunization gaps are prevailing still from the pandemic, COVID-19 pandemic phase. And the zero dose and the under-vaccinated children are still an issue because one in five of our children globally do not have any access to essential immunization. Can you imagine that? And backflash to the COVID-19 pandemic situation in 2021, we can see the global dropout of vaccination, and that was the lowest rate over a decade. And we can guide it from the data that we can get guided from the data that around 25 million children around the year didn't give any vaccine, and 18 million children who are zero dose children. They out of these 18 million children, around 62%, that is 11 million children, just live in the 10 countries, and these children lives in the fragile or conflict-affected countries, or in terms of the hard-to-reach on high-risk areas in the world. So the next slide is that about the immunization agenda. Can you please go next? And immunization agenda is a global landscape about the global action principles towards immunization, and it has 7 strategic priorities to get the sustaining development goals of the health and the human rights as well. And if we follow the first 2 strategic priorities, that is commitment and demand and coverage and equity, and we can assume that the opinion leaders can be change makers right there. And the commitment to be immunized creates demand in the community, and due to the demand generation, the community encourages themselves to take vaccines that improves the immunization coverage. And also we need to focus on the equity of distribution of the vaccines and the gender barriers as well. So the core principles of the immunization agenda, the first thing is that it should be people-centered, and the country should own the vaccination principles in their national immunization technical advisory groups. And there should be multiple involvement of the partnerships and stakeholders, and there should be data-guided actions for formulation of the policies and the frameworks as well. So at this moment, I warmly welcome one of our distinguished expert panels, Carolina De Navarro, the scientist and the medical epidemiologist from the Immunization and Vaccine Biologicals Department from WHO headquarters, Geneva, to share her knowledge about the global landscape on the importance of the opinion leaders to achieve global immunization agenda 2030. Carolina, can you please unmute yourself for a short brief and take the lead, please?
Thank you. Good afternoon, good morning, good evening, everyone. I hope you can hear me. And thank you, Dr. Faisal, for the invitation to join your group. I think the topic you decided to cover today is really crucial. I put in the chat the behavioral and social drivers model for immunization. And let me walk you through that model a little bit. So to really understand the key role that opinion leaders play there. So basically, your own perceptions of risk of diseases and what you think about vaccines will make you think, do I want to have my children vaccinated? Do I want to get vaccinated? And then the social norms in your community, what do my neighbor, what does he do? The social processes, what are the social norms? Is it normal to get vaccinated in my community? Does everybody I know take their children to be vaccinated or not? So here is where we really, really want to say, yes, our leaders make it normal in our religious communities, in our societies, in any other group, and even in our health workers, that inviting people to be vaccinated and just offering the vaccine every time and checking cards and making sure children are up to date, even catch up children, even if they are a little late, it becomes part of the motivation to get people vaccinated. So basically the motivation comes from your own thinking about diseases, about the vaccines, but also really important here about what's the cultural and social norms in your community, and opinion leaders can really make a difference there. So then you are motivated to go vaccinated. Of course, in the behavioral and social drivers model, then you have to know where to get vaccinated and the practical issues. So the opinion leaders here are also part of this idea of partnership based of the Immunization Agenda 2030, where the partnership doesn't mean partners here at the global level. It really means partnering everywhere with whom you work. So for example, I come from Latin America. In Latin America, it was very common to partner with the firefighters, for example, when you need transportation, or when there is a fair, to take the opportunity to promote health. So I really invite you, oops, there is some noise. I really invite you to follow the presentation that the group has prepared for you, keeping in mind that this is the social norms, and therefore the opinion leaders have a key role to play in increasing motivation to get vaccines. And then of course you have to ensure that the practical tools are there so that the person can get vaccinated. Thank you for the invitation again. Back to you.
Thank you, Carolina, for your valuable opinions. And we are just here to motivate ourselves so that we can boost up the opinion leaders in the different countries, and the different cultures and the different barriers are well addressed. And also we can follow the social drivers and the behavioral drivers. Thank you. The next slide, please. Eunice, the next slide, please. Yes, this is the general concept of vaccination, that why we vaccinated. Actually, we are vaccinating our children, and even we are vaccinated during the life course vaccination, like the COVID-19 and others, as a response of the pandemic. So these are for the gaining immunity, and the child has the right to be immunized, as we said earlier. And by the contrast of that, we can say that it is a very cost-effective intervention, health intervention. And along with that, the water and sanitation and hygiene, that could be another issue to address, well addressed. And vaccination is the effective way to protect ourselves, because the vaccination has some primary principles that it will not harm the recipient, and it will not harm the vaccinator, and it will not harm the environment. That means the environment should be, waste disposal should be there, and everything should be there, so that the vaccination is a simple and safe way and effective way to reduce the risk of getting other diseases. And vaccine, we know this has dramatic contributions, and it has much more impact on our health to get us relief from the different childhood illness and our children. And the vaccination is always for the prevention of the disease. And the next slide. We have some flashback of memories that we have some success on the immunization, that polio globally almost on the eradication phase, but if not eradicated due to some of the countries are still prevailing the polio disease, but it has radically reduced the number of the global poliomyelitis cases. And also it eradicates the smallpoxes and the neonatal tetanus and other things that we can say that vaccine has reduced the incidence of the diseases. And the vaccine contains some killed or weakened forms of germs. As we know, the vaccine has different types, like it is live attenuated vaccine, and also that means the live attenuated vaccine. That means the weakened form of the vaccine components are used here, along with the other vaccine components. And then next, as we know, the antimicrobial resistance is a global concern, as we are indiscriminately using and prescribing the antibiotics to our children when they are suffering from the common childhood illness like pneumonia and other things. And we have some vaccines to prevent pneumonia and the rotavirus vaccine to prevent the diarrhea. As we know, the rotavirus is a viral disease, but antibiotics are prescribed on that time. So it is also a concern of global antimicrobial resistance, and vaccine has a role to reduce that. And as we know, how do the work of the vaccine? It strengthens our immunity, and it also helps us to create antibodies within our body. The type B or type T cells are stimulated, and type B cells are produced due to the vaccine when injected in our body or in other forms. So it boosts our immune system to fight the infections, and it also keeps the memory in future for the further any invasion or infection. Next slide, please. So what are the vaccine preventable diseases under expanded program on immunization, that is API? We have the BCG vaccine for prevention of the childhood tuberculosis and the pentavalent vaccine. As we know, it contains 5 vaccines. That's why its name is Penta. It contains DPT, that means diphtheria, pertussis, and tetanus, and the hepatitis B and the Haemophilus influenza type B vaccines. In many countries, DPT vaccine are being given as a part of the schedule. In many countries, pentavalent vaccines are replaced by DPT. And we have the OPV, oral poliovirus vaccine, and the IPV, that means inactivated polio vaccine for the prevention of the poliomyelitis. And OPV has 3 serotypes. OPV, that is in some of the countries, 2 serotypes, vaccine BOPV, and some countries MOPV are being used. And IPV is a full dose used in some countries, and also fractional doses of 2 IPV, that means inactivated polio vaccines are scheduled for the vaccines of the children, immunization of the children. And PCV vaccine is for the pneumococcal pneumonia, actually. And the MR vaccine is a very crucial vaccine, that is measles and rubella vaccine. And TT vaccine, this is a tetanus toxoid, as we all know. It is replaced in some of the countries with TD, that means tetanus and diphtheria. And HPV vaccine are being inserted as a response to the cervical cancer, and it is being introduced as a new vaccine in so many countries. And the Japanese encephalitis virus vaccine, it is being introduced in some of the countries as endemic countries where the Japanese encephalitis disease is prevalent. And rotaviral disease, as we already described that earlier, that it is one of the most common causes of the death of the children is diarrhea. Under infant mortality rate reduces because of this vaccine. Rotaviral vaccine is there, and typhoid vaccine, TCV, typhoid conjugate vaccine, is being used. So we are not prescribing or writing anything here, like an immunization schedule is not here. It is shared in the WHO website, because the immunization schedule varies from country to country, and we are just saying vaccines available under immunization program in different countries. So the now floor is to my fellow colleague, it is Umo, to present from now onwards.
Okay, good morning, good afternoon, good evening from wherever you are. My name is Umu, and I will be taking you through our various opinion leaders, who they are and why they are important to us as immunization champions. So our opinion leaders are sometimes called or known as influencers in our communities, whose expert advice is respected by everyone because of the level of control they have in their field. They are also authorities on specific topics. We call them subject matter experts, and they help to shape the public opinion about various topics and interventions. They generally carry some amount of authority over the community in which they live, and they may include public administrators, religious leaders, teachers, cultural leaders, amongst others, in such a way that when they speak, the community listens. And this is why we need them on board to increase immunization uptake. Next slide, please. Okay, so our key opinion leaders, like we said, they are researchers. They can be researchers, they can be healthcare professionals, or they can be professionals from other health, life areas. They could be police, they could be just anyone. So the key thing to know is that they have authority over the area in which they have specialized. They could be influencers. We have friends who can have influence on our daily choices. We have advisors, we have mentors, we have people who we follow either on social media or other areas in our lives. And they could also be thought leaders. That is, they could be advocates. And like we said, they could be expert matter, SMP, subject matter experts, and some of them are just generally respected. Now, it is key to know that our key opinion leaders live in communities where they have influence over just anybody in that community. Next slide, please. Okay, now we need to know the general roles of key opinion leaders. We summarize them into 8 categories with the roles that they have or that they play towards healthcare services in general. For the government, they formulate policies and legislation to promote health of the general population. And for our politicians, we expect that they will influence the governmental health decisions. For the clinical commissioning groups, we expect that they will and the the medical professional societies will announce new research or formulate research and development that will advise on how to protect the interest of patients or the general population. Now, for our journalists, our media practitioners, we expect that they will report on issues, and not just that, but they will be able to use factual information to dispel rumors, mis and disinformation concerning healthcare services. We expect that the patient advocacy groups will educate, advocate, and provide support services for patients and other people in need. So for our pharmacists, they will distribute the medicine and also oversee the correct use by both patients and the professionals. And for our service providers, we expect that they will administer medicine, especially during their clinical practice time. Next slide, please. Next slide, please. Okay, now we have talked about the general role of our key opinion leaders. Now we need to know why we need them in immunization. First of all, we need them to know that there is an increase in the number of zero-dose children. When we say zero-dose children, we are talking about children who have not received pentavalent or DPT-containing vaccine first dose. These children are living in communities and their numbers are increasing over time. And then we also have under-vaccinated children, children who have started their vaccination schedule but have not completed. We have them living in our communities. Now, if we combine our zero-dose children and our under-vaccinated children, this leaves a gap in the community that can easily be overcome by vaccine preventable disease outbreaks or children just coming down randomly with diseases that we are actually providing vaccine to prevent. And this will lead to more other susceptible children, and then we cannot achieve herd immunity with that. Next slide, please. When we talk about herd immunity, this is a scenario to showing this is a scenario showing how herd immunity is how it works, in fact. Now, for the figures in green, these are the people in the community who have been vaccinated or have built immunity towards a specific disease. Now, for the figures in the black, we have people who are just maybe vaccinated but have not achieved immunity or have not been vaccinated at all. So they are susceptible to any given disease that they have not been vaccinated against. Now, if you have few vaccinated people in the community and you have more people who are susceptible, the disease will easily transmit from one person to another, and even those who are vaccinated will be highly at risk. So this is how you see the disease spreading among people who are susceptible in the community. This shows you that if you have under-vaccinated community, you stand a chance of having a vaccine preventable disease outbreak. Next slide, please. Now, here we look at the magic of high immunization uptake in a particular community. Now, see how beautiful it looks with all the figures in green who have built immunity against a particular disease, and we just have few susceptible people there because most of them have been vaccinated and have gained immunity. So even if a disease comes and we have few susceptible people, the vaccinated or immune people will prevent that disease from reaching the susceptible people. This is what we call herd immunity in a community. Next slide, please. Now we have specific roles for our key opinion leaders to help us reduce immunization gaps in our communities, our countries. First of all, we want them to provide correct messages to address rumors and misconceptions related to immunization. This will help parents and caretakers to take their children for immunization services and even complete the schedule, and even they themselves who need their vaccines that they are targeted for to uptake the services. We also want them to be role models by making sure that all their own children and other children in their care are fully immunized. We want them to advocate for immunization services uptake by making use of every opportunity. This can be at a place of worship, wedding, community meetings. They can easily make announcements on immunization, and they can also influence household decision makers' beliefs and values in immunization. Because as we all know, if the head of a household does not see the need for anyone in that household to be immunized, it's going to be difficult to get that person to be vaccinated. We want them to collaborate with other leaders to sensitize communities on immunization benefits, identify under-immunized zero-dose children and link them to health facilities. And then we want them to promote routine immunization in hard-to-reach areas or humanitarian settings, because these are where we have underserved populations. Next slide, please. Finally, we want our key opinion leaders to remember these 4 steps in reducing immunization gap in their communities. Our change can start from our community and then our country, and then we'll have a global society with high immunization coverage. So we want us to remind our parents and caretakers to always keep their child health card safe and to take the children for all immunization appointment, and to also always carry the card whenever they visit any health facility. We want them to participate in health facility management or development committee for planning, implementing, and monitoring immunization services along with other healthcare services. We want them to look or report any vaccine preventable disease that is identified in the community. It could be measles, it could be yellow fever, just any vaccine preventable disease identified. They should alert the parent or caretaker of that child to take them to the nearest health facility for immediate medical care. And then we want us all to kindly use all mass media, local media, and social media to continue to remind our parents and caretakers or caregivers about immunization services, the benefits that it has to us, our children, and the community at large. So at this point, I would like to turn over to our brother Fred, who will take us through his story, his public narrative story. Over.
Sorry. Thank you, Humu. Team participants, thank you very much for listening to us. One of the key strategies of activating communities for action is through storytelling. And one of our colleagues, Fred, developed a very nice story that is calling us for action in immunization through involvement of the opinion leaders at the community level. Is a success story and is also a call to action through storytelling. So we want to welcome Fred to take us through the story. Welcome on board.
Thank you, moderator, for the time given. Since the story is already embedded into the video, let's go through the presentation through this video.
I can share the video now, Fred.
Please, you can do so.
Okay, one moment.
Immunization service delivery has not been an easy task to complete. We have a lot of new vaccines being introduced, and at some points, this has created fear amongst the targeted communities, such that the vaccine acceptance has not been automatic. Sanji, like other districts in Malawi, also struggled to introduce the new vaccines to the targeted communities. The biggest challenge was observed during the introduction of COVID-19 vaccine. There were a lot of refusals due to the false information regarding COVID-19 vaccination circulating within our communities. It took the district more than a year to reach just 9% of the target population. After noting that one of the reasons for low buy-ins of some health interventions brought to their communities was that some local leaders could not take the messages they got from the meetings they attended to their subjects, we changed the approach. We started engaging the opinion leaders in their respective villages and areas of influence. One of the opinion leaders engaged was Bubu village headman Kapombe, who after engagement challenged the vaccinators to bring COVID-19 vaccine during the day scheduled for community mobilization in his village. The village head also promised to be the first one to receive the vaccine on the day in order to clear the fear his subjects had regarding COVID-19 vaccination. During the meeting, the village head addressed and convinced his subjects to receive the vaccine. We were astonished noting that at the end of the session, over 95% of the eligible people in his village got COVID-19 vaccine on that day, asking the village head why people had such sudden change of mind and embraced the vaccine. Kapompeza said the meeting which we had with him, he had false information and the fear he had against the vaccine. He further said now he knew the importance of the vaccine and he had to make sure his subjects understood the importance, get the vaccine, and be protected from the pandemic. Taking lessons from the success story from village head Kapompeza, we cascaded the approach to other village heads, religious groups, and parent teachers associations. The coverage did not take long to improve. In less than 4 months, the coverage rose from 9% to 37%. The coverage which we failed to reach for the period of more than a year and some months. This critically highlights the importance of opinion leaders on the buy-ins from the health interventions we take to their communities. Leaders spare time to provide adequate information to opinion leaders regarding all health interventions, lest we will continue struggling to realize zero-dose free communities and prevent vaccine preventable morbidity and mortality.
Apologies for the breaking of the video at some points, but as the storytelling takes us through to the importance of local leaders, how are they important to help in convincing people get the vaccine? So as already alluded to in the previous slides, the video was just augmenting what was already presented, and also to ensure that at all costs, opinion leaders should be part and parcel of the immunization team. Thanks. Eunice, you can take back.
Thank you very much, Fred. I'm sure we have learned something. Storytelling is one of the powerful tools of sharing information and pulling a crowd for action. And it goes a long way because you are telling a story that you already know, and then moving the crowd for action so that they are able to see the gap. Now they can be convinced. If it happened in another region, then it can actually happen. We can still use the same skill, the same strategy, and I'm sure it's going to work in other places. We had, thank you so much, Fred, for that. The next scenario is actually a field scenario that is actually telling us about the gaps that we'll find in the community, and is a scenario of reaching every district whereby the community is not able to accept immunization services because of one, low coverage due to nomadic groups. They have difficult to reach, and the states have refused immunization services for religious reasons. In addition, vaccination teams reported resistance to immunization services during outreach sessions and during SIS in some areas that have traditionally had longer coverage but not provide details. So when you look at this field scenario and what Fred has actually shared, they all agree together that at the community, we have all these challenges. A community will say, we are not going to take this vaccine because our leader has not said so. Although the community might be having the right information, but as long as the leader does not give them the go-ahead to go for the vaccination, then it is unlikely that they are going to accept or they are going to pick the services, especially the immunization services within the community. So it is very important that we continue working with the local leaders, we continue supporting them, giving them the right information so that we can address the myths and the misconceptions and give the right information. So from this learning, what are we learning from evidence? How are we going ahead? What is the way forward? How do we continue engaging and supporting the opinion leaders to deliver or to continue supporting the community to accept immunization services? And we are saying, going forward, we want to empower them to be able to communicate the right information. Yeah, by ensuring that they have the right information in terms of immunization, and they have the right information in terms of the vaccines that are being given to the children. They are already assured, they are already approved by the global bodies like UNICEF and WHO and the Ministry of Health within the country where the services are being offered, has already approved that. We want the opinion leaders to be able to provide the correct, clearly scientific information, because we are going to be to have empowered, we will have already empowered them with the right information. We want them to be able to guide the community by one, understanding what are the gender barriers within the community that are actually preventing the women, their children from visiting the health facilities to be able to get the MNCH services and the immunization, the maternal, neonatal, child health services, and the related immunization services that we really need. We want them to tap knowledge from the healthcare workers or the expertise that is already existing within the community so that they can continue supporting the healthcare workers, the technical expertise can continue supporting them. They can invite them during the community meetings, the cultural forums, so that they can speak to the community and the community will actually listen. We want them to tap the knowledge by being able to report and vaccine preventable diseases, including event-based surveillance to the nearest health facilities, so that whatever is happening, everyone is aware, and then there is what we call the early detection, notification, and the response system actually happens. So we want to engage the opinion leaders to be part of the surveillance system. And then we want them to work with by collaborating with the health experts and mobilization of the vaccine acceptors and demand generation within the community. Anytime we are maybe organizing for a campaign, an outreach program, we want the opinion leaders to take the lead by creating the crowd, by mobilizing team, by giving them the right information and ensuring that every community, every member of that particular community actually understands why it is important for them to get that vaccine. And again, very important, we always say that the community leaders are actually the eyes and the ears of the government. We want them to participate in the health facility activities, in planning, in budgeting, and in resource mobilization. This will ensure that they know what are the gaps that are already existing at the facility as they work with the healthcare workers within the facility to know what is the gap in terms of immunization, what is the gap in terms of the other health-related activities, and how can they engage the community where they are living in to ensure that everybody plays their role in ensuring that immunization coverage is achieved. So thank you very much. Then the next thing we are going to take is we are going to have a question and answer. If you have any question, feel free to send in our chat, feel free to open up your mic, and then just raise an hand, and then we'll be able to respond. Thank you very much.
I can see one question in the chat box. That was,
you can read it for us, please.
Yes. It is a question by Abdi Zamal. A question to Fred. How did you handle this misinformation and infodemic? And were the opinion leaders vaccinated? Fred,
Yes.
please
Thanks.
answer.
Okay. Normally, how we have been handling the issue of opinion leaders in Malawi, we have been calling them to one point and brief them regarding the intervention which we are planning to implement in a particular community. So we have been doing so. Now, despite that we have been doing that way, we noted that the information was not reaching the targeted community, the subjects of the local leaders, because some of the local leaders couldn't share the information which they got from the meetings. Now, after noting this, we said, okay, let's engage each opinion leader in his village or area of influence. So it means now the vaccinator of that particular area had to engage the targeted opinion leader. Then after targeting the opinion leader could book him or her, and then as supervisors could join the vaccinator with some friends to make sure that we discuss regarding the issue in question and convince the opinion leader. We also allowed the opinion leader to put forward the concerns, the worries, the questions they could have regarding the vaccine in particular. Like in this case, it was COVID-19 vaccine. So in that situation, the opinion leader had all his or her time to feel relaxed, because we could allow him, as we allowed them to ask a question, it also gave us time to discuss with the local leaders until we feel that the local leader has the right information. We have cleared the concerns, we have cleared the false information, and then it's when now we could ask the opinion leader to engage his or her subjects. Then also was supposed to sketch a meeting with the subjects. During that meeting, we were also in attendance. But now we allowed the village to address the targeted community. So in so doing, now the subject could hear from their leader, not from us, because the health workers were only there to convince the village head and get the right information. Sure. So that's how we have been doing when we changed the approach, and it's what we did with.
Thank you, Fred. Can you please tell in terms of coverage how the coverage was improved? Can you please tell that? How the coverage improved after engaging the opinion leaders in that community?
So after engage, by the time we started changing the approach, our coverage is only 9%, which took us a year plus some months. But now, after engaging the targeted opinion leaders from their respective areas of influence, the coverage rose from 9% to 37% within 4 months. It's when we appreciated the importance of opinion leaders on influencing their subjects to embrace health interventions.
Thank you, Fred. I can see to raise hands here.
Yeah.
Dr. Abdul Mateen, can you please unmute yourself and ask your question, please?
Thank you. Thank you all. First of all, I would like to thank to organizer and also presenter. It was really a good informative presentation. So in this aspect, I'd like to ask one question, and I was really grateful to the organizer. It's such a good and organized presentation. So my question is how opinion leaders can be integrated with health facilities? I mean, how they can integrate it with health facility? I'd like to throw this question to the team. Anyone can answer. Thank you.
That's a nice question. Eunice, can you take the lead of the question, please? Eunice,
thank you so much. Yeah, thank you very much. In my last presentation, I just said that the community is actually the eyes and the ears of the government. So to say that, one way of engaging communities is by ensuring that they are key participants in the health management committees or health management boards. I don't know the kind of names you use in different, the different names are used in different countries. So at different countries, you'll find at every level of service delivery, if it's a health center, it's a hospital, there's a different structure, which is a governance structure that lies in the government system, whereby we have the health facility management committees or health facility management boards, whereby the community is expected to be participants. They are supposed to play a key role by ensuring that they are part and parcel. They are participating in those committees by being members. Either they can be the chair, they can be elected to be the secretary, but we expect them to take lead, to be part and parcel of that. So when they are there, then they'll be able to know what is happening within the health facility. And one of the key roles of health facility management committees is to ensure that every time they are meeting, they are able to review the performance of the facility, really going through all the data that is being generated at the facility level and being able to know what are the gaps, and then asking themselves, what is the root cause of these gaps? And then they are able to come up with interventions. So they are able to support the staff within the facility to come up with interventions that are tailored towards addressing the gaps within the facility. At the same time, they are also participants. They participate in the planning of the facility activities. They also participate in coming up with budgets for the facilities so that they can be funded by the government. So they play a very key role in ensuring that the service uptake in that particular facility that is within their catchment area, which is within their jurisdiction, it's high, by ensuring that they are participating in the planning, they are participating in the budgeting, they are reviewing the data, they are supporting the staff. And most important, they're also engaging the community. They're organizing what we call community engagement forums to ensure that they are able to address the gaps picked as a team. Thank you very much.
Yes, thank you. Thank you, Eunice. We have some few raised hands here. And in addition to that, I should share the experience here in Bangladesh. That is practice, that is the community clinic concept is there, where the public-private partnership and the government has initiated it to build up a community clinic in each of the rural areas where the public and private partnership are made, as well as the donation of the land is given from the community, and the medicine supply and the human resource supply and the facility supply are given by the government. That's how the community is integrated well with the community clinic concept here in Bangladesh. So the next, I can see a few of the more raised hands. Petzak has raised his hand. Can you please unmute yourself and ask the question to the panel, please? Yes, Pedza, you.
Oh, it's me. Oh, yeah, sure. I didn't have a question. I just wanted to congratulate the team on a great conversation here, and to remind, maybe just to ask at the end, like for people to turn on their camera so we can take a group photo of this amazing group that is participating. But I see two other hands, so I'm gonna.
Yes. I can go to update. I can go to now. Kobu, can you please unmute yourself and ask the question? Nokobo, please. If you are not ready, Abdi Zamal, you raised your hand. Can you please ask your question? So, are you ready to ask the question?
Afternoon.
Yes.
Yes.
Thank
Afternoon. Yes. My name is Busisu Ngobo from Eastern Cape, Pizana. I would like to share the story that we had here in Eastern Cape during pandemic. There was a big gap of knowledge about how vaccines work. As you know, that in rural areas, there's a lack of network, so people are clueless about how vaccines work. So as the organization, we've visited schools and communities, working with leaders, doing vaccine literacy. And then after that, the rate of people that have been vaccinated has been raised up. So they were afraid of taking vaccines because there were fake stories about the vaccine. So I think vaccine literacy is very important for people who reside in rural areas. They must know how vaccines work, and then I would like to share that.
Thank you for sharing. Yes, so I am placing the floor to Lotalis. Can you please unmute yourself and give the vote of thanks to the whole participant as we are ending at the webinar, almost 1 hour, 7:30 p.m. right here in Bangladesh. I don't know whether you are joining. Please, Lotalis, unmute yourself.
Okay, thank you very much. First of all, I would like to give thanks to Almighty God who gave us this chance to participate in such a nice meeting. As I can see from the chat, people are very interested to have this meeting. Okay. Also, thank you all our facilitators who have been taking us through until we reach this meeting. Also, I thank all participants who participated, who took time to listen to us for this opinion leaders meeting. Maybe in short, we have been looking on the immunization responsibilities, and we said that the immunization is the responsibility for every one of us. I think everyone was able to respond on that, and actually we are very happy because our class was very sharp from the initial of this session. Also, we've gone through about the fact about immunization gaps. We learned the different things there. Also, we go to the strategies for immunization, priorities, especially for the immunization agenda for 2030. We learned about the coverage and the equity. We had also vaccine preventable diseases. We saw the different types of vaccines, like the vaccine against the polio vaccines, PCV, Penta, Surua, HPV vaccine. We had several vaccines there we saw. Also went to opinion leaders, which was our key.
100.
That was our key session in this. I can see some noises somewhere. We learned about the opinion leaders, and we said they are highly influential people, high authority, and they are ambassador for everything in the community level. But with our lesson, it was just to focus on immunization activities. If we use them, if they use their platforms, actually we can increase, they can assist us to increase the immunization coverage. Maybe I think the take-home message from this presentation is that all of us, we are opinion leaders where we come from. So we need to be to take role as ambassador to make sure that we take role of making sure that we educate the community about the immunization services to make sure that they reach a very high coverage. As we saw that due to pandemic, which happened in 2021, the immunization coverage dropped. Now, so we have the role now to make sure that we use different platforms we have from where we come from to make sure that we stand in our feet to make sure we advocate for immunization services so that we can increase the immunization coverage. Thank you. May I take this opportunity also to our team leader, Eunice, to finalize and say bye to the members. Thank you.
Probably before Eunice comes back, I just want to extend what Rotaris was saying. We have also to acknowledge the Boost community for the wonderful support which has given the team from for a period of around 4 months. We don't take that for granted. We also acknowledge the support which we have received from Sabine Vaccine Institute, and even you team, the ones who joined us, who have attended this meeting. We appreciate very much for this. And even the team members for group 2, your time, your inputs cannot go without being noticed. And even our classmates, we appreciate for your critical inputs during the preparation of this webinar. Thank you very much. Thanks, everybody. Thank you very much, Eunice, for being our nice team lead who has been understanding and cooperative, very nice reader. Thanks very much, everyone. Take over, Eunice.
Thank you very much, everyone. I want to appreciate my great team for the great work we have done. Thank you for the great participation during the preparation of the slides, for the great presentations. Thank you, Homo. Thank you, Fred. Thank you, Dr. Pfizer. Thank you, Lotaris. We are all a great team. We want to appreciate the people-powered health. They are giving us the power to do public narrative. I'm sure you have all enjoyed the presentation that was done by Fred. It was really a call to action. We never had that skill before. We got it through the people power health. We want to appreciate all our facilitators, all of them. We are so grateful for the great knowledge, the great experience that we have acquired during this training. We really appreciate. And we want to thank you all participants for finding time to come and learn with us.